We are in the process of great economic, social, and political transformations. But change and the need for innovative solutions is not new for the nonprofit sector. In fact, St. Stephen's Community House, like other neighborhood houses, was born as a neighborhood-based solution to address the unique needs of the people in our community. Our social service sector is not new to disruptions and change and innovation. We were born of that, and our programs and initiatives today reflect that reality.
Probably one of the greatest examples of the core innovation that we put into our programs is our integrative model of care. It allows young people access to clinical mental health services as well as a nurse practitioner. They don't need to register, they don't need to be documented or have ID or anything of that nature. There's no barriers, no obstacles to young people accessing service.
The TRUSTEE Hub is a great example of adjacent innovation in that it grew out of our regular programs and services. There was a bubbling of participants that were self-organizing and grassroots organizing, and that would often need trusteeship when they got to a point of applying for funding, and to have us as an organization assist where some of the capacity building gaps were around financial accountabilities and HR processes, and some of the things that aren't the drivers of their work as grassroots organizations.
There is a whole system that at first felt very overwhelming, but once we had this guidance, it felt doable and it felt something that is sustainable for us.
The homeless program at St. Stephen's was transformative and innovative in a sense that it wasn't something that I was repeatedly doing for people or giving people. It was actually a process where people participated in the program with me. And that meant you had to have something in place that people really wanted. They saw a goal that they wanted to achieve within their life that perhaps they just didn't have before.
The very first peer program that we had start up in 2014 came from a need voiced by our participants. We see a heightened sense of engagement from program participants that are connected with our peer workers. It really closes the gap that a lot of vulnerable communities will experience in accessing either justice or health care or social isolation. Those elements are addressed through peer work.
Whether it's core, adjacent, or transformational innovation, the House helps individuals create opportunities to adapt, mitigate, and fundamentally change the nature of the challenges that life throws their way.
The House has the experience and the grassroots knowledge, and we are moving to a more systemic approach to strategic innovation. But we can't do that alone, and we are working with the whole community to make that happen.
The House is walking the talk. We're creating the conditions for our sector's future transformations today.
The House is open.
It's curious.
Entrepreneurial and nurturing.
Imaginative.
Empowering.
The House. Innovation lives here.